Okay, I think we're officially live. Okay, so we will begin with our very first question, which is what type of humanitarian work, sorry, I think there's an error with that question, but what type of humanitarian work are you involved in? We can direct this question to Pernille.
Sorry, a little late on the new thing. Well, I've done the work. My very first mission, it was in South Sudan, where I was based project. And here we worked in a big refugee camps with 50,000 refugees, where IPSF was in charge of the biggest health station there. And as the pharmacist, my work was to ensure that we have medicine for all the products there. So that was sort of my first involvement, and I would say a very good introduction to being a humanitarian work, because it's to all your, like how you imagine living out in a little tukul and for 6 months, and yeah, and really meeting the people and working to staff was refugees themselves. So it was really an amazing first experience as a humanitarian pharmacist, I would say. And being on the ground, you know, where it really matters where you are. Since then, I have been more the mission pharmacist. So, and that what that means is that it's more like a more coordinating role. So instead of directly in the project, I have been based more in capitals. So when I was in Yemen, I was based in the capital, Sana'a, of course, visiting our projects in Yemen. And that has been the same role I have had in my other missions in Iraq and in Bangladesh. So then you move a little further away from the ground, I would say, but you're still on the ground, but you are not there every single day out to see the patients, because you have a more coordinating role, making sure you get medicine into the country, making sure that the quality of the products are correct in all our products. And then I've also done more advocacy. For instance, in Iraq, we worked a lot to ensure that we could get a vaccination campaign. So that meant that we had to go speak to the government and all the people in charge of vaccinations. So I would say sort of way from the bottom to the top. I don't know if that answers your question. Want more details on some of that, but yeah, I would say, yeah. Otherwise, give any follow-up questions, because I do this so much, so you know, you sort of lose the details of what people would like to know.
Okay, thank you so much, Pernille. So that was a great answer, actually. I think it just goes to show the variety of work that you were doing. Like, it wasn't kind of like the same thing day in, day out. So it sounds like there was quite a big variation. Is there anything that either Lucas or Anna has to add to that, or no? Go ahead, Anna.
Okay, thank you. Yeah, I think what Pernille explained is pretty much what two sort of pharmacist jobs that we can have in missions. One interesting experience that I had as well was in 2016. We were working in Iraq with well, basically. It was a time where ISIS was being displaced out of Mosul, so there was a lot of activity in the area. There were people that had been displaced already for a while, and there were also people that, due to the current situation of ISIS being displaced of Mosul, they were also having to move quite often. And it was very interesting, because this was a very hands-on sort of trying to go with the different forces that were in the field and try to take care of the people. So with the mobile health teams, or actually we end up also creating centers and camps that were receiving these people. This overflow quite intense, and this, I think, as a pharmacist was quite different, because well, at this time I had to do a bit of different work, not only to ensure the supply of medicines, but sometimes as well being the actual pharmacist were supporting the doctors in the needs, because at some point there was a need, a lot of people in the terrain. And I think this is the kind of thing we're not taught in college. It's very much the how to go from being the procurer, being the person that supplies the medicine, and the other second there's an emergency, there's an urgent need in a place, there's enough doctors, there's not enough pharmacists, and we need to sort of fill in. So when you say what type of humanitarian work you did, sometimes you do different types in only one mission, and sometimes in only 1 week. And that's the sort of mentality that I wanted to share a bit, that you cannot think, oh, I'm going to just do this. Your job might end up changing quite a lot throughout the mission, throughout a week even.
Thank you so much, Anna. Lucas, do you have anything to add?
Yeah, the work on Yemen. So I work for Yemen. I'm working now for Yemen, and last year I worked for Iraq. They are very different interventions. They are all humanitarian, but it's another world, because in Yemen we are working with emergency situation, while I was in Iraq was early recovery. So okay, the worst moment has passed. Now we have to recover. And while in Iraq, I was working with internally displaced people and refugees. Now I work with the host community, let's say, so with the own Yemen community that is from that own region. So there is also this on the humanitarian work. It's all humanitarian, but when you go from one context to other, everything changes. And well, I like this. So it's how is the experience for us as humanitarians.
Thank you so much, Lucas. We've actually received kind of like a follow-up question a little bit, which is, do you deal, which I guess kind of your experiences I've already answered a little bit, but I will just mention it anyway. So the question is, do you deal with more direct patient care or supply chain / logistics, or both? So it sounds like from your experiences that you kind of dealt with both, whereas maybe you were anticipating it would just be supply chain, but actually it ended up being more hands-on. Does anyone have anything that they want to contribute to this question?
Can I? Or
Yeah, go ahead.
okay. Yeah, but I would say that is actually sort of, I guess, the heart of it is that, as both Anna and Lucas also mentioned, that yes, it's everything. Like what we do is everything, because it's advising or doctors or nurses on what medicines they can use. You are running out of one product or another. Is being in direct contact with the patients. It is in charge of the supply chain. It is doing building up a new warehouse if you don't have one, from the way from the bottom. It is being in the middle of emergency and just going hour by hour. So it's everything. But yeah.
I would like to include
teaching is,
yeah.
I would say, the most important. Is coaching and teaching the staff, for me at least, but that's, I guess.
Yeah, I was going to add that there's a big training component. Actually, something that surprised me, that you end up training, especially if you're a mission pharmacist, is you end up training a big part of the team that you're responsible of, even recruiting people as well. Was a big part of the role. So it's more than just the supply chain and the actual technical and scientific knowledge that we have. There's a lot of administrative tasks as well. For example, building new warehouse, either in a space in a center, or actually in a central storage unit, training the staff, developing the own training materials as well. So it's much more than we're used to in our technical background in university.
Yeah, for me, I didn't have the experience with the connection directly with the beneficiary. So in this mission and in my past mission, I was already, past mission really in the coordination level as mission pharmacist. And now I'm on the base level because my base is in Moha in the west coast of Yemen. So in both situations, I may see the beneficiaries when going to the field, but I didn't have the opportunity to work directly or as dispensing or as something else. Maybe the ones who are beneficiaries but also are working with us, maybe those I had more contact, but it was mostly really a coordination focused and management position.
Okay, thank you so much, guys, for your response to that question. We've actually received another follow-up question to that, which again, I think maybe some of you have already answered, but I'll ask it anyway, which is that, what do you think you could have done in pharmacy school that would have prepared you better for this job? I have a feeling some of you will say that nothing could have prepared you for this job, but you can go ahead and answer the question. Whoever wants to go first.
I can go.
Sure, go ahead.
In my university, what I could have done in my graduation, I don't think I could have done much more than what I did, to be honest. And maybe what I did with IPSF actually was good, but was not regarding graduation, right? It was, well, it was my will to do that. So, but I can say what I missed, what I think that could have been the university and would made the difference would be something on logistics. So at least for my graduation, there was no chair on logistics. So I had to learn for myself on logistics from Brazil. And then when you go for a mission and you have to understand the logistics in a global emergency level, well, it's something that you have to learn from the scratch. And really, it's not something that it was in my university. I don't know the others, but this would have made the difference if I had.
Go ahead, Anna.
Sorry for now. I think in my case, what I would have appreciated would be know more about good manufacturing practice, actually how to understand the quality of suppliers and distributors, as well as products, because this is something that, for example, if we have issues in procurement and we end up have to procure locally, this assessment was sometimes required, and this would be something that I think I would appreciate. I didn't have it in my degree, and I think it would have been good. And also maybe some more basic disciplines, some maybe in economics, in addition to supply chain, but I think economics or even some policy as well, because we end up being advocates for a specific challenge that NGOs, refugees, IDPs, etc. face within a country, internationally, etc. And this is something that indeed IPSF brings us, and we end up acquiring this knowledge on the side, on the associative and organizational world, but not on a specific degree. I think it sometimes is doesn't focus enough on the social sciences aspects as well. Yeah.
Thank you, Anna. I don't know if Pernille has anything to add or no.
Not much, but I would say that I think much of what I have drawn on in the field has also been experiences. And I would say for myself, well, I did a lot of student politics, not in IPSF, but in nationally in Denmark. And a lot of the skills I got there is what have saved me during the day, just as much as my pharmacy degree. And also what I did miss when I started out was definitely the logistics, because it came as a big shock for me that I do so much logistics. It was like, I thought, here I come and I have to, look at what kind of treatments they're using. And in the beginning, that was not what I spent the most time on. What I did was what, at least in Denmark, or pharmacy assistants mostly responsible for in the pharmacy. So that was not what I did as a pharmacist in the pharmacy. So yeah, but I had some very good colleagues in the pharmacy to work. So I had a little one-on-one with them before for my first mission. So that helped, but it was not something I was taught in school.
Thank you so much, Pernille. So our next question kind of goes hand in hand again with what you were talking about, which is what are some challenges that you faced, some specific challenges that you faced while in the field? So I know you guys have mentioned a little bit about managing like logistics and things like that, but aside from that, like what are like the biggest challenges you faced whilst in your work? I can go ahead with Lucas.
I have a good one. So one of the countries that I worked, it's a criminal offense to have or to transport waste. I don't know why the country decided this is a good idea, but they decided that having or transporting is a criminal offense, and we had waste. So what to do? We didn't have incinerator. Headquarters didn't approve for us to buy one incinerator. It was a huge discussion. And then in some moment, people started getting stressed with the waste. And look, we have to do something. What if the army appears here and get us with this? So we look into the reference and the bibliography about this. And we found that the WHO validated approved method for waste management, which was about taking all the pills and making a powder of this, mix with cement, and make, in our case, a sidewalk. So probably this was one of the most interesting challenges that we did, because we really did a sidewalk. So we had no sidewalk in our guest house. We did a very nice sidewalk there made of waste. And well, this was something that, of course, was funny, the whole situation. We got our fingers without feelings of taking medicines from the blisters and other waste. But this was something that we could get the information, the pharmacists could make the work happen, because, okay, we all got together, studied the bibliography, and did something really responsible for this waste management. So I think this was one of the most different challenges that I had.
Thank you so much, Lucas. I think that's super interesting, actually, like making it into like a sidewalk. Maybe that's something that other countries should utilize, a method of managing waste instead of like throwing it into like landfills and like in the water supply. It's a good idea, that.
Ideally is not forbidden, not have forbidden waste, right? You create a system for this, but well, it's forbidden, we have to find a way.
Yeah, definitely. Does anyone have anything else to add, or go ahead, Anna?
So actually, I also wanted to mention in the question before, but I can connect it this one. I think that there was a lot of data when I first arrived to the mission. There never been a mission pharmacist, so the pharmacy was sort of a bit delivered to a couple of local pharmacists, and they were not communicating very much with each other. So there was no system between all the pharmacies. And then once you start connecting it, you understand that people actually don't use the data that is available. And there was a lot of information available also that could have prevented a lot of waste and things going out of date. I think another challenge as well is to implement new methods. So for example, having a method that follows the prescriptions from the moment that the doctor prescribes until the dispensing in the pharmacy. This is a big challenge, because we're talking about context where they are used to a very specific system. It's not that they are not used to new technologies, they are, but they still it's very hard to change mentalities once pharmacy or a PHCC, so a primary healthcare center, has been established, then it's very hard to change the mentalities. And then I actually have a couple of other topics that I put down. Another challenge for me was actually understanding the security context. So as a pharmacist, I was very much looking into the pharmacy needs, the scientific aspects. I hope nobody ever asked me about anything else. But then at some point you need to know that sometimes you have staff under your management and you need to take decisions. Am I going to send this staff to the field or not? Is it okay to go to the PHCC today? There was a device showing at the door of the PHCC. Is it okay to actually tell the staff just to go home? Or so you as a manager, you also end up to have to understand about other areas. And for me, security was quite challenging, and having to understand all of the different devices that we could come across in our field visits, that our staff could come across, that was challenging. Another one is to understand the context of security, but more like the customary context. So what people perceive as right and wrong. And for example, there were situations where a specific community was being under attack or menaced. And then you need to take the decision of members of that community maybe cannot go to the field that day. So you need to start understanding a bit more. So if this challenge have happened, you need to start following the news and take decisions so that your staff don't end up trapped in an area where there's potential issues with them being kidnapped or being held hostage. So that for me was very difficult. I never thought I would have to take this sort of decisions. But there's also people that are very knowledgeable in security in these missions. But don't think that it's only other people. As a manager, you also have to sometimes give your opinion. Another challenge for me was actually, as a pharmacist, I had to set up the first aid kits. And people would ask me, like, oh, what did this compose? And should we add something? Like, well, I know a bit about first aid, but I need to tell me which sort of injuries or issues we could be facing, because as a pharmacist, I didn't take care only of the IDPs or refugees or host community, your colleagues also as well. These first aid kits are for your colleagues, either national staff, international staff, to have in the office in the case of an emergency. So this was also a bit challenging. Yeah. And like Lucas said, very good resources. A lot of time is to look online, and WHO and other international organizations have a lot of information that can help us.
Thank you so much, Anna. We've also received a follow-up question to this, which again is very similar to what you've already answered, which is how do you ensure the safety of your workplace when working in areas of conflict? I know Lucas and Anna, both you've mentioned about some of like the challenges maybe being to do with like security and things like that. But I'll direct this question to Pernille since she hasn't answered in this topic. But I'll just no? Oh yeah.
No, sorry. Yeah. Sorry. Yeah, I didn't. Sorry, not. So I shouldn't answer the specific challenge, but your other question, right?
Yeah, it's up to you. You could answer either. You could just roll it into one.
I can take both, because I think because the specific ones made me sort of think that what I think is the most important is to be agile. And when I was in Yemen, we were facing the big cholera outbreak. It came out of nowhere. We didn't have medicine to handle a cholera outbreak like that, because it hadn't been seen in Yemen before of this size. I think that sort of also tells the line of what we do, because you never know when a new emergency arrives. And Yemen is already like one of the biggest crises in the world, and there's so much going on, many challenges. And then all on the top, you get a cholera outbreak, and we didn't have the medicine to handle this. And I was only there in the when we faced the beginning, and it evolved a lot bigger. But just to say, in that view, as a pharmacist, very important to face this, because we were part of ensuring that we talk to all the different organizations who have actually a kit that can handle a cholera outbreak, and talk to some of the other NGOs. How do we get medicine into the country? So Okay, we have the first response. Okay, so now we get more into the country for the next response. It's not going away in a week or two. This is just the first response. So where can we get a ringer lactate? Where can we get what I need for the emergency we stand in? So sort of this collaboration between the pharmacist and the rest of the medical team and the NGOs is just really like the core outbreak stands clear for me as one of the biggest challenges I have been part of. But it is also a high security country, so it sort of also reflects back on what you said, because in a setting like this, you cannot always just send a new truck to the area because it has to be safe for the driver to drive, and it also has to be safe for me to go there. Just to say it as it is, it's not always safe. Like that, it is a risk. It's a risk if I go to Yemen because dealing bombs, you don't know what happens tomorrow, but you know you have to trust that you're safe. And you have, and I have also been evacuated from other countries where I've been, not from the country, but from my project to another city because of incidents. But it's part of the job, I would say. But I really put my trust in the people who are in charge of security when I'm there, and I have never actually people always ask me if I felt unsafe. I have never felt unsafe, and that is the truth, despite of where I have been. Like I have never felt unsafe. I know there's a risk, and yeah, but I think it's part of the job. I don't know if that answers your questions regarding security.
Thank you so much, Pernille.
I'm
It's really,
naive, you know. So
what was that? Sorry.
as I say, I know I'm naive in this area. So I also, but yeah, when it comes to security, but I don't have to be. And it's not, I react when I'm told that I have to leave, you know. I don't question it. I say, okay, if my boss says, okay, we're leaving now, I don't wait 5 minutes. I go to the car and we leave. It's not a question. It's not a discussion. I just act.
Mm-hmm. All right, thank you so much, Pernille. It's really insightful to hear, I guess, because for someone like myself, I have no experience in humanitarian work, but it's definitely something that's interested me. But to me, I've always worried that, you know, what you said about the feeling of not feeling safe. So it's quite interesting to see that, obviously, you know, you have never really felt unsafe, and that you have a lot of trust, and you have to have a lot of trust in those that are, you know, protecting you. So thank you so much for your answers there. Just to kind of move on from that topic, the next question is about, you know, we've talked about a lot about the challenges, but now we want to ask you, what are some of the biggest rewards of working in the humanitarian field? I'll go with Anna, if that's okay.
Sure. I just want to add actually the demanding physical and psychological of humanitarian work. Sometimes it's not even only yours. I don't know. I'm a person that sort of gets very like when other people around me are not well, it sort of troubles me as well. So even if you're good at managing your own psychologic, and you're like, I would go to the pool almost every day. So physically and psychologically, actually, I could deal very well with me. But then you have many other people that are also far from their home, that feel stressed, etc. So sometimes it's not only depending on you. So I'd like to add that as well. What are the biggest rewards for me was the fact that first, this was my first job other than internship or a traineeship. So for me was the fact that someone was putting so much trust in me to manage people, to coordinate teams. It was also the fact that despite of being a woman in a context where usually men are more seen as the ones holding this sort of professions, and also having the last say and the leading role, I felt quite respected by my staff. I feel like in the beginning they didn't understand very well, you know, why is there an expat doing this type of job? They also have pharmacists in their well, they have pharmacy degrees, etc. But you know, they ended up understanding that, you know, some issues related with the procurement and dealing with international organizations, etc., that sometimes indeed my support was very, very welcome. So I think that there's this rewards. It's something that people end up thinking that there's also no other type of compensation. Like it's not all altruistic. Huh? There's the fact, for example, that I was managing big teams at a young age for me was very rewarding, and that's not in the sense altruistic. I think it was also for me sort of something me accomplishing something professionally. So I think people need to see this as also getting some rewards that either are personal or professional, because the challenges are indeed a lot, and no one does it only for the altruistic sense, or at least not for a really long time, because indeed it's quite challenging. And yeah, I think that's for me the main things.
Thank you, Anna. I'll also direct that question to Lucas as well.
I don't think that it's a work for anyone. Moving country, going to some places that you cannot go unless you are humanitarian, or places that are dangerous. You're going to be isolated. Sometimes you have no electricity. And Yemen, Iraq, yeah, the electricity goes down several times a day. And sometimes the country might decide to turn off the internet of the country, which when this first happened in Iraq, I was like, is it even possible to turn off the internet of the entire country? And they did more than once, so it can be extremely challenging. And we, after even one mission, few months, you can see that this can go very tough. So I don't think it's for anyone. You need to be somehow ready for it. But for me, yeah, two big rewards. First one, I know that I'm helping actually someone, so I didn't feel this working in the pharmacy. I didn't feel this in the research. Even the research, I felt a little more, but it was still very far. But no, this one you are actually doing that have a direct or a very close impact. And to know that I'm doing something good and not just giving profit to my boss who will watch me working and get the profit from me is amazing. I do the work and all my effort goes to support who really needs and not someone who does not. So this is the greatest. And the second, yes, I think that is professionally good. Is the area that I like. It's something related to international relations. So before IPSF, now humanitarian. So follows through what I enjoy. So doing what you like, doing the good for the others and feel good with this, that's very good.
Thank you so much, Lucas. And Pernille, do you have anything to add?
Yeah, well, at least for me, it's also about the beneficiary. Like you see, it depends on context, and it's quite different what people need. You really see the impact on the beneficiary, and that you are not there, they will not get the help that they need. And for me, that is really important. And for me, it's also about my staff. Like I will lie if I don't say that. That for me is also one of the rewards, is seeing the people you work with grow. Like for instance, I was working in South Sudan. The staff I had, they don't have any education. They know how to read, they know how to count, and that's it. So what I teach them is what they learn. And if you're there for 6 months, you really see people grow. Of course, it depends again on context. I've also been in Yemen and Iraq. I have very well educated staff, and they are also pharmacists. So they don't grow that much because I'm there, but there's one interaction that I learn something from them and they learn something from me, and that also really rewarding. So for me, it's the interaction with the people I work with and the people I am managing grow, and then of course the beneficiary in the end.
Thank you so much, Pernille. So our next question, I guess, it doesn't really, it's not specifically to Lucas, I guess it could be to Anna and Pernille as well. But there was a recent article published, Lucas, in collaboration with FIP, which was on the topic of gender inequality in humanitarian interventions. And I wanted to ask this question actually because it kind of plays into what Anna already spoke about how, maybe it's not typically seen as, females being in this area of work. But how did you see that humanitarian actors can become better in integrating gender issues when working in the humanitarian field? I don't know who wants to go with that first. Lucas?
Okay, as the article was mine, okay. So yeah, first, thank you for noticing the article. It came in the last year Congress of FIP. So they have this amazing day that had several sessions on gender equality. I could join all of them. It was very interesting. And even some of the points came to me now in what I do today. So it was really a good time to hear. And when you think about humanitarian situation on gender issues, it's very complicated because first you have the group of, let's imagine on the staff, or depending on the situation, that you have local gender rules that you cannot challenge them, even if they are bad for the local health of the population. So the community health volunteers in Yemen, they all must be women and they cannot talk to men in any moment. So how can I have someone who is there to teach and to raise awareness to the community who cannot reach about 50% of the community by itself? So you have initially the gender challenge inside the culture that is almost impossible to break, or needs to be something really, really slow. On the other hand, you have the staff that you can actually choose, and this is the whole point of the article. When I arrived in Iraq, I was the first man to be the mission pharmacist. So from Anna to me, we're all women. And I had this sense in my first recruitment process. So, okay, let me see the pharmacy around the mission in Iraq, how it is on matters of gender balance. And I realized that there was no woman in the pharmacy. Going deeper on it, we realized that in some of the primary healthcare centers that we had, a woman could enter the primary healthcare, go to the nurse, go to the physician, go to the pharmacist, and leave the PHC without seeing a woman any moment. So this, okay, let's try to fix it and do something and encourage and try to put some women to this gender balanced, and realize that was not easy. It was not just something from us. They didn't apply. So we opened positions for pharmacists in every position of the pharmacy, including myself, my own position for mission pharmacist. And we had a very big trouble, or it was because of family, then they could not travel, or it was safety, that they didn't feel safe to be a pharmacist in a refugee camp, or they had other matters that actually we only hired one woman, but she stayed like 2 months and then the government called her to work. So even when you have a positive attitude towards this in the humanitarian sector, where you can make the change, it is not easy. It's really challenging to have the gender balance. So I imagine that for us working in managing positions and recruiting, we have at least to be mindful that, okay, we have to try to support because we need them. We need the woman in as leadership positions, people for us to be inspired on, but we also need them in the field with the patients. So this is the challenge. something for us to work on every time.
Thank you so much, Lucas. Over to Anna.
I'd just like to add that when I was in Iraq as well, we tried to implement this sexual and reproductive health clinic. So it was really a safe space for women because there were other activities that were mostly frequented by men. And this was actually a very successful activity for some women. We had quite a very good attendance, but then we started noticing that we were only seeing a very few patients that were women in comparison with the population of the camp. So the population of the camp at that time was almost 14,000 people, and the amount of women we were seeing per month, I think, were less than 100. So this was very, very small amount, especially having in consideration the addition of people to the services. And when we tried to understand, we saw that actually some women were not allowed to leave the house without the husband. So the husband would go working during the day. The woman could not attend on any of the activities. And even when the women wanted and the husband was present, he was not willing to go with her and she could not go by herself. So either she was locked at home or she needed a chaperone that was not willing to accompany her. So this was quite challenging. And it's funny that Lucas also mentioned recruiting, because in my time, I tried to recruit female doctors, female pharmacists. Female doctors is a bit easier, but pharmacists, like technicians, etc., it was almost impossible because they needed the husband to accompany them to work, during work, then on the trip back, and this was simply not possible. So it's really, really, really challenging. And it's also challenging for us that are doing international work, that we get into this context. We sort of get a bit more free card because, they don't understand us overall, our culture, our context. So they sort of let it escape. But as a female, I felt a lot of challenges. And, you're not trying to compete with the men, you're simply trying to fulfill your position, and then you're managing a man that sees you more of a competition than per se his manager or someone trying to support. So I'm very happy that Pernille had the opportunity, for example, to train staff and see some evolution. But in my case, there were a lot of times that I could not see this because the staff was not willing to learn from me. And this is a huge, even if you establish gender balance, it doesn't work in this context. Well, I'm not saying that we should give up on it, but it's quite challenging, and this needs to come from the communities. So I saw some women there that didn't want to get married so that they could stay, have some freedom and stay working with us, for example. And once they actually engage with international organization and start to know us that with a different culture, I think they also understand that there were other options and other ways of living as well. But it's very challenging. But maybe, Pernille, you've been in more context, because for us it's a bit the same. What do you think?
Well, I think it's quite depending on context, but I think overall, at least the organization I work with, it's quite high on the agenda, that we have gender integrated gender issues, if you could say that, or that we're working on this. But I haven't been in a context where it's the same for me as it is at home. No context I have been in. It's been like this, but it's quite different. When I was in South Sudan, every man could have four. It's okay, but the wife couldn't, and so on and so on. But I think what, at least when you're there, what you can do is create opportunities, like, so women have a chance to move forward. I think also, as you both have mentioned, it's about, okay, now I actually have a job opening. Can I actually recruit a female? And I have also tried to do that, but I don't always have qualified applicants. And then it's not a possibility. Even though, okay, I say, okay, this is a female, is going for the test, even though I don't see, she at least have a chance if she shows. And of course, then also on the job, like, I have had a lot of discussion with my staff about these issues, and colleagues in general, and just the awareness, I think. But I do know, at least in the organization I work, that it's something that we're working on, but you're facing it all the time. So I cannot say I haven't any issues as a woman either, because I have when I've been to the field, and I have also had staff that didn't always respect me because I was a woman. So it's not, but then I took the fight. So it's not I haven't won all battles, but I don't win battles at home either. So I think one step at a time, and then you try. And I think the important is, if when you're there, that you try to create some opportunities for the local females there. And the culture is different from each country, and the opportunities are different from each country. I don't know if this make any sense, but
Thank you so much, Pernille, and all of you, actually. I'm really glad we managed to address this topic, actually, because I guess it really brings to light some of the inequalities that, not only you guys as people that have gone there to work, but also, members of the public. And it must really be, quite a different, it must be kind of like a culture shock, really, because not only is it, not only in day to day, maybe sometimes we see gender inequality, but then when you go to a completely different country that you have like no experience with, and like the culture is different, the communities are different, the religion is different, like there's so many different aspects to it, and all of these kind of look like a bit of like a barrier or like a challenge. But it's really good to see that there's a lot of motivating words behind it, like just because there are challenges for women, or just in general, it doesn't mean that we shouldn't stop advocating for these causes, or advocating for women in those communities to be more involved with the work that you guys do. So thank you so much for your input on this. Just kind of moving on from a little bit of the like experience aspect of it, I kind of want to move on to some technical questions, more about like the logistical aspects of working in the humanitarian field. So this question that we received is, what are some of the work benefits that were provided to humanitarian workers, and is humanitarian work financially benefiting? I know this can be a little bit of maybe a touchy question, but I think people really want to know, the reality of the work. So I guess whoever wants to go first.
I can say something as I don't know if that is correct me if I misunderstood the question, but when I go I do get paid, so I don't know if that is the question. It's not voluntarily. I don't get salary I will get if I have a job at home. There's a reason I'm on a break at the moment. I just sort of need to get my finance back on track. But I do get a paycheck, and I give of it, so it's quite good. And I think it depends on from what country you come from. At least, yeah. I don't know, work benefits. Is that like normal benefits you get from your work at home, or what is meant? I guess if I go to the field, I don't pay for accommodation in the country I live. I don't get pay for my food is also included, and I get a sort of allowance that I can live up in the country, and then I get my normal paycheck as well, that I have to pay my expense at home and stuff like that. I don't know if this sort of at least I do when I work for Medicine Sans Frontiers. Yeah.
Can I go? I actually think it's a bit similar. In my experience, we did have something different, which is the food doesn't get paid for. So we had the place to live, so the guest house or an apartment that we share with other people or not in some exclusive situations. We also have transportation. Usually in the country, it's paid. Also, you have to go on a trip every 6 months. And then if we want to go on holidays in the middle, that's paid by us. We also have some, depending on the country, you can have more or less holidays. Usually we were requested to stop every 3 months. So we have the break at 6 months, but then at 3 and 9 months, we had this R&R. So it's sort of like a rest, because these are intense contexts. But I know that in some contexts there's no R&R, and in other contexts you have an R&R every, I don't know, 6 weeks or something like that. So it depends on the context. Indeed, we also got an allowance. It depends on the context where you are. And there's also health benefits. So in our case, we had a very good insurance. So it depends on the NGO again, but it was quite good. And it depends. You can also, in some cases, negotiate your salary. So, of course, if you're in my case and it's your first job, I didn't have a lot of arguments to negotiate with. But there are some NGOs that have fixed salaries per positions, and there are others that are a bit more, exactly, MSF, and there are others that are a bit more flexible. And actually, if they're really desperate to get a health coordinator and they need someone good and you're worth, they might go a bit higher. So in many cases, it is like any other job, and you might have to negotiate with your boss like any other job as well. But yeah, we're paid. And but I would like to highlight that there's also a lot of people that work as a volunteer, or there's this, I think MSF has this 1 year volunteer before you become more permanent, sort of, or better salaried.
You get paid, but you get paid in the first year as well, but it's not the same way as after 1 year.
Yeah, exactly. And there's a lot of volunteers that actually don't get paid, and they're at their own expense. Yeah, and that's a bit, I think we're lucky, because pharmacists, we have a background that usually is paid, but there are people that, to get into their field, like if you're a finance person or a human resource person, sometimes you need to get some experience, non-paid experience, before getting paid. And I think pharmacists are quite lucky in that aspect.
Thank you so much, Pernille and Anna. I don't know, Lucas, do you have anything different to add, or is it all the same? That's fine. Thank you so much. So I guess the next question is actually something that we have received many questions about this, a lot of repetitive questions from people. So I guess many people are very interested in what you guys have had to say, which is really good to know. And so one of the big questions people have is like, how can they join humanitarian pharmacist missions, and how can they be a part of these activities that you guys have been able to be a part of? Go ahead, Lucas.
You know, for me, what driven me the most to become and start to be a humanitarian, it was Anna. So having a good friend who gives you the idea to run for a position is very good, first of all. Although at the time that she told me, I say, that's going to Iraq, what are you talking? I'm not going. And then afterwards, I got the chance again, and then I applied, and it was the best choice ever. So I think that there are two groups that is easier to get into activity. So those who are living in a country with a humanitarian response, because they will be looking for locals to join. And I have seen people who are nationals and they grew in the position and they become expats afterwards. So this is a possibility. And for other countries that have a headquarters, is also simple, so they can just apply maybe for an internship or something in the headquarters. And this happened at least a lot in Iraq, that many people were people who finished working in the headquarters and went to the field for the first time. So I think these two, they are more privileged to find positions. But for everyone else, and of course for those other people, you have the website, the Relief Web, which is where everything that you can imagine about humanitarians there, including job opportunities. So I think is one of the most important resources out there. LinkedIn is also good. There are lots of positions for humanitarians there.
Thank you, Lucas. Can you just type that website into the chat box, do you think, just so that people can, you know, have the direct access to it? Does anyone have anything else to add?
I will add,
Yeah, go
because
ahead.
I think also my one was a bit different. I remember sending an email to MSF office in Denmark to hear if they used pharmacists, because I didn't know, and it had always been a dream me that like to do humanitarian work. So for me, it's a lifelong dream. And then they asked for my CV, and I thought they would evaluate if they could use a pharmacist. And then I was called for an interview. So in that sense, I was quite lucky. But I think what I would advise, this is something that you're considering, one, like just do it, but also do some volunteer where you are, because usually in your own country, you do something. Like for instance, I have also, so before I joined, I was active at home in Pharmacists Without Borders, because we have that in Denmark, and I've also volunteered there now, and that gives you some sort of insight, and maybe there's a project you can support, and maybe so that way you can also come abroad to help in these projects. But I would just say do some volunteer work do some volunteer work in the country where you live. Maybe you're able to do some community work where they need a pharmacist, and then start that way. And then if you like it, then move on. And maybe that's not for you, then just apply for one of the bigger NGOs. It's not only MSF and PUI, but many NGOs out there who are in need of pharmacists. So I would just say try it out. You don't start the work from day one. You can start applying and start volunteering and getting into it. And okay, maybe it also took a long time from I applied till I got hired to like actually standing in the field. It took from we can use you. It took 9 months before I was in the field. It's a long process. So so to do it, and I can only recommend it. I have never regretted my decision. This decision of my life was doing this work. So
Just as a sorry,
it's
just
all
as a
the
quick
hard yeah.
Just as a quick follow up. So I know you said that the your journey was quite a long. How long do you think? How long, I guess, did it take from the moment that you applied to now the experience, the work that you're in now? Like, how long do you think that took? Obviously, I know different NGOs will have different the time it takes for you to get to the point that you are now. Obviously, it will vary, but just as an example.
I think I sent my official application, which I didn't an official application, till I was in the field. I would say about 10, 11 for me. But it depends on the NGO, it depends on the time, it depends on your qualifications. So I wouldn't say that it takes this long. It could take shorter, it could take longer, depending on. I think like if you apply for a direct job, then okay, it will go faster. But when you work for MSF, you are applying generally. You don't apply for a specific mission, because that comes later. The first evaluate if you are fitted for MSF, and if you're fitted for it and you have done all the tests, which is also a month long with a lot of different kind of tests, then let's find a mission that fits your file, and then we move from there. So it's quite different from if you go to the site that look also said, or that calls NGO jobs, you will find a job and you will directly for that job, and then the process is quite different. So again, depending, I think, on NGOs.
Thank you so much, Pernille. Anna, yeah, you can go ahead.
Thank you. So I would like to say that a lot of people, now you heard about PUI and about MSF, but now these are only 2 organizations. Actually, when I was first looking, what people told me is like go to grassroots organizations that are still quite small, but do a lot of work in health. So in this site that Lucas has put, Relief Web, you will find that there are many, many actors, and some organizations are, easier to get in than others. So, for example, when I was looking, and I was always looking for MSF, and indeed, I think MSF is harder than, because everybody's looking for MSF. So, try others. Of course, always check the NGOs online, see their reputation, see what other employees also say. There are groups in Facebook. There's this one called 50 Shades of Aid. if you're applying for a position, actually they can tell, you know, I had this experience, I had that, and you can also sort of assess, because it's harder to assess an NGO as an employee, especially security wise, etc., an NGO than a company. So I would advise you to check for that. Then, like Lucas said, LinkedIn and is getting more and more stronger with the humanitarian jobs. Nowadays, you find both field, but also headquarter positions there. Another point that Pernille made is like take initiative. I think some of my first jobs, I must have sent, you know, 50 or more applications, and I got 1 or 2 responses. And now the rate of approval is higher, but in the beginning was quite low, and that's fine. I will write the name in a few minutes in the chat, the 50 Shades of 8. Someone is asking in the chat. But what I would like to say is that don't be shy, because my first job, I got this interview, and I think someone was like, oh, I saw this CV, and let's just see. And the whole time they spent the interview saying, oh, you're too young, you're too inexperienced. And I got 3 interviews like this. I got to the end interview, and they were like, yes, we like you, but you know, you're too young, too inexperienced, the whole time. I was like, well, it's not my job. It's not mine for sure. I don't even now know why they keep me this long. And in the end, they call me and they say, well, you're recruited. I'm like, what? But wasn't I too inexperienced? Wasn't I too, you know, young? Oh yeah, but you actually know how to deal with Excel, and this other person that we had doesn't. I was like, okay, and that's all that it took. And that was my first job, and they were looking for someone senior, and I didn't have half of the qualifications they were requesting. And I think that in the end they were quite happy with my job. So, you know, we have this tendency, especially when we're starting, you know, maybe I don't fit this job, maybe I don't fit this description. If you try, a no is always a given. So don't be shy, and also don't be disappointed, because sometimes you go into the last one and you think, well, other people are better. No, maybe other people knew how to work Excel better. Doesn't mean they're better, you know. So keep your confidence up, and I think that's very important, to show this confidence. Then I also had another point. I wanted to say something, because going on these missions, I think it looks quite glamorous at the moment, because we get paid and we have some good benefits. But also remember that there's times between the mission that we don't get paid and we don't have benefits. We don't have health insurance, we don't have a salary, we don't have savings. So either you do a very good job saving while you're in the mission for the time that you're not, or you need to find alternatives as well. So if you know a pharmacy that needs a pharmacist, you know, for a few months while you're off or something like that, that will help also, because staying at home for long periods sometimes is difficult. A pharmacist is not that you find a job, a mission after a mission after a mission, so quick. So to have that in mind as well.
Thank you so much, Anna. Is there anyone else to add anything? No? Okay, thank you so much. So I guess now we'll go on to the last question, which I think some of you have already kind of answered, but the question is, what are some words of inspiration that you can give to those that are looking to work in the humanitarian field? I don't know who wants to go first.
I can, but it sounds so much like I have a very grown-up advice. People won't be fine, but I'm also old now. Okay, no, but remember to take care of yourself. If you don't take care of yourself, you cannot actually help others, and take breaks in your missions. At least I didn't do that in the beginning because I love my work so much, and also actually just referring to what Anna said, that I didn't have a job between, I didn't have a salary in between missions, so I just then pharmacist in Denmark sort of requires I stay home longer, and I didn't want that. I wanted to go to the field. But retrospective, I should have taken longer breaks between my missions, because they are quite tiring, and it's like I, at least, because I've been most to emergency missions, and not all MSF pharmacists do that either. Sort of that was what ended up on my table. That also required a massive amount of work when I was in the field, and I wasn't very good at taking care of myself all the time. I've learned because I had to. So I think it's really important when you're in the field that you take care of yourself, and also in between, that you take proper breaks, because then you last longer, and you will enjoy work more as well. I know this is a very grown up, boring like advice, but like I working by myself, so don't don't take it wrong way, but it's just important also to take care of yourself.
Thank you so much, Pernille, for those wise words. Who wants to go next? Lucas?
I go with Pernil on this. I think we see often people going for workaholic standard and working many hours more, but I think the humanitarian is special on this aspect. You really need to care of your mind. So this is one for sure that I agree. The second is, don't think that it's glamorous, right? It's a big decision to go to a humanitarian mission. You leave your country, you leave everyone you know behind. You're going to live with someone that you don't know, and probably more than one person in the same house, multicultural probably. So people from different contexts and language. You see, it's a lot of things that needs to be included on the decision to go. So you cannot go just because you think you are doing something good or because you are paid or something. No, I think it's something like applying to become a police officer or a fireman or a soccer, like a first respondent. Is something really special that you have to put before. So for all those who think that they have the energy to do this, I think that yes, they should really apply, because it's the people who recognize that they have this on them that can go for this work. So recognize this in yourself first, and then apply. The world needs help.
Thank you so much, Lucas. And last but not least, Anna.
Thank you. So I would like to say if you want to do something like this, to do it now. I hear a lot of people saying, well, I'll take a job in my country and then I'll see. You cannot find partners in these missions, or you can, but maybe not for a really long time. So if you have a boyfriend at home and you want to do it and then you come back, that's one thing. If you go with the hope that you'll find someone in a mission and then you'll just do missions forever together, no. And a lot of people go into this mistake. So I am just to tell you, it's also very hard to raise a family in this context. Like I know people that actually stayed, and some missions allow for it to have kids, but it's also first it's very hard to find these positions, and then it's a very these are very constricted environments. So like if you want to do it now while you're young. My mom did it when she was 50 something. It was a completely different experience, and I think you enjoy it much more, and it's a lesson that you take for life. You learn how to engage with other people, living with them, working with them 24/7. It's not something you want to do when you want your own space and you're worried about your wife at home that is raising her kid, or your husband at home that is worried about you. It's good to do it when you have the stamina, but also the social context that allows. Then indeed, like Pernille says, take care of yourself, do exercise, because in these countries a lot of times it's hard to find a place to do exercise. I found a pool and I stick to it like there was no tomorrow, because it was very rare to find something like that. There was no one else there, because literally it was not used, it was just me, so it was very good. But also eat well. These countries a lot of times it's harder to access vegetables and nice fruits, and we end up eating a lot locally. And local food is one of the reasons why sometimes we have such high burden of NCDs, etc. So try to eat healthy, try to from the beginning to taste local food, but also eat healthy and maintain yourself healthy. Yeah, do it now before your priorities change, because maybe now it's your career and then one day will be something else. So yeah, I think Pernille has something to say on that. No, you're laughing a lot.
No, yeah, but it was just hilarious. But it was not that one. It's because we all sound a bit sick now. So I just want to end by saying that it's the most rewarding job in the world, I would say, and the teamwork that, like, for instance, when I was in Yemen, like the whole of both local and international staff, we were really coming together to solve the issues. And I find this is one of the most rewarding things. So also to add on a positive note that it is really worth it. And I would say what you bring home, because I'm also home having a normal job now, but just the take home is also like I don't get stressed when my colleagues get stressed. I just it's like you can really put a lot of my without I'm starting to panic because I have seen a lot. Nobody is dying today, so we can fix this. And so I would say you also bring back a lot of qualifications that you don't put on everybody's personal qualifications that makes you like which really benefit you in your day job. It's different from everyone I know, but also the negotiations, and you're able to work with a lot of people from different cultures, and this you also take back with you if you want to stay in that line of. So just also to say some of the things.
Thank you so much, Pernille. And I guess with those positive words, we will end our wonderful talk show. So I just want to say a massive thank you to our wonderful speakers that have taken time out of their day to join us, and show us good insights into humanitarian work. I think you will have motivated many people that were watching. We received so many questions, and unfortunately, we weren't able to answer all of them, but I hope that we were able to give everyone who is watching the live stream or is joining us on Zoom, that we were able to give you a good background into what humanitarian work is like. I hope you understood some of the great experiences that people have had, but also some of the technical aspects as well, how to get involved. So just for the last time, I want to say thank you so much to our wonderful speakers, and thank you so much to everyone for attending this wonderful event. We will be sharing the recording with all participants, and it will be saved on our YouTube channel, which is where this is currently live streaming. If you have any other questions, you can either reach out to myself or Nisa, the humanitarian coordinator, and we will try and maybe get some questions answered. But yeah, thank you so much to everyone. It's been a great time. Thank you.
Thank you very much.
Thank you all.
Have a nice evening or morning.